What's up, guys? Welcome back once again. Lighting is a little harsh, but we have to do the best we can given the fact that we are in the reading room. Typical life of a radiologist, I guess. So if you're new to this channel, my name is Ramiz. I'm a board-certified internal medicine physician, currently back in training for a second residency. I'm currently in my second year of radiology training, and what I want to talk about today is something a little bit interesting, a little bit of an interesting conversation that I was having. It's this dynamic and it's this well-known struggle between quantity and quality. And essentially what it is that from a very young age, we're always taught that quality is more important than quantity. And that's something that's pretty much ingrained in our minds from a very young age. And at the end of the day, let's talk like adults. To be successful, you need both. There's no way you can just make it by with just quality or just make it by with just quantity. So obviously we're going to need both. But, if we were to decide, what do I think is more important? Is quality more important or quantity more important? And I think the answer might surprise you. So what I feel is that quantity ends up building quality. The more times you do something, the more things you produce, the more practice that you do, you eventually end up building quality. And so I think that focusing too much on quality is actually a detriment. And I think people need to focus more on quantity. And I feel like people are not focusing enough on that. I'll give you a perfect example, typical medical student example or a doctor example. You need to study, and the topic is huge and broad. And you know that studying for this topic is going to take a lot of time. So you have a massive goal ahead of you, and you know that to make a change on this goal, you're going to need to study for 6, 8, 10 hours a day. So as a typical doctor or medical student, you want to be studying in the most ideal environment. So you want, the best tech, you want it to be quiet, you want it to be a decent time to study. So you will set up the ideal time frame to actually sit down and study. But in order for you to get to that level, sometimes you have other obligations that come in the way. Some of those might be related to work, some of those might be related to outside of work. And then essentially what happens is by the time you finally get to that level where you want to be in order to get the most quality studying possible, it's too late and you're just never going to be able to accomplish that goal. Now compare that to another student, which is going to be someone who focuses on quantity. You might see them reading on their phone. You might see them quickly doing 1 or 2 practice questions here and there while they're in the middle of rounds, while they're on their lunch break. Maybe if it's they're doing some other activity and they're just reading little things here and there. Maybe while you're driving, you might be listening to like a podcast. You're just constantly engaging your mind with some sort of information related to medicine. You're not doing the typical quality, books are out, you're at the table, you have the perfect peripherals, and you're doing the perfect quality study time. But instead, you're doing little pockets here and there, little pockets here and there. Over time, that student who's picking up little bits of knowledge here and there, studying on their spare time, random 10, 15 minutes of study multiple times throughout the day, that little bit really does add up. And that's something I wish I knew earlier on. I myself have made this mistake many a times where I want to be studying in the most ideal environment and I won't take advantage of these random down moments. And I feel like, my colleagues and other students that I've seen that have actually taken the time to take out 10, 15 minutes here, scrolling on their phone, reading about different diseases, those people really, I really believe those people end up being successful, and I've seen them become very successful. And the way that it happens is because when you wait for the ideal moment, you can never catch up to the amount of volume and the amount of exposure that these other students have had. And at the end of the day, that's what medicine studying is all about. It's all about gaining the maximum exposure. It's all about gaining experience. The more experience and the more exposure that you have, the better of a physician you're going to be. So like I said, at the end of the day, quality is extremely important. All the work that you do, this is even outside of medicine, but all the work that you do, you should always, aim for the highest quality possible that you can achieve. However, just remember, don't let quantity suffer because of a possible lack of quality or a less than ideal quality state. Because as you build up the quantity, as you do the task more often, as you expose your mind to these things more often, the quantity will end up leading to you developing a very high level of quality. And here, I'll give you another example. Back when I was training in internal medicine, I would take care of a patient, let's say with diabetic ketoacidosis. So I would tell myself, you know what, tonight I'm going to go home, I'm going to make a nice cup of coffee, I'm going to sit down and I'm going to study for diabetic ketoacidosis. Well, 8 hours later in that shift, I would admit another patient with another diagnosis. And that patient may be sicker, maybe something a little bit more interesting or something more fresh in my mind. That night I would go home and read about the second patient who has, let's say, pancreatic adenocarcinoma. So I would start reading about, pancreatic adenocarcinoma, and I would forget to read about diabetic ketoacidosis, as opposed to some of my colleagues who would admit a patient with diabetic ketoacidosis. They would sit there and read about it even for 15 minutes, 10 minutes right then and there. Later on that day, during the day, before anything else happens that occupies your mind, they would sit there and they would just read a little bit more about diabetic ketoacidosis, maybe do 3-4 practice questions here and there. And guess what? Those people ended up being way better, not only when it came to boards, but when it came to random pimping sessions and attendings asking them questions. And overall, they were just broadening their knowledge base. Now, I didn't have the intention to not study diabetic ketoacidosis that night, but another matter that came up that happened to be a little bit more important at that time, and it happened to be a little bit more fresh in my mind, made me forget about studying for diabetic ketoacidosis. But if I had, right at that moment, or if I had throughout the day, even in those small bursts, the only reason that stopped me from doing it is because I already had a plan in my mind that when I go home today, this is the agenda, this is what I'm going to do. I'm going to sit down and I'm just going to, get it done. But at the end of the day, sometimes other things come up. So that's why it's better. You have to train your mind that it's better to just do tasks in very small bits, even in the less than ideal circumstances, less quality work. It's better to do the quantity and put in the work. Even when you're really tired, it's better to do 20% of what you normally would have done if you had more energy than doing nothing at all. So let me know your thoughts down below. If you enjoyed the content, don't forget to like and subscribe. Every like, every subscription actually helps me quite a lot. And let me know your thoughts down below on this video. Do you feel quantity is more important, or do you feel quality is more important? And like I said, we know as adults, we need both. There's no such thing as just one over the other. But if you did have to choose, what are your thoughts on this topic? Let me know, and until next time.